It is nothing different than any other industry. It is also a same kind of adaptation is there. What Upkar has said, or Vishwajit and other people they have spoken here, all are correct, and all are applicable to the healthcare industry also. Healthcare, the major problems is that the mindset of the people in healthcare people to change when we do the process reengineering, and they do not like to accept the new processes you will ask for, because they do not have that much of exposure to take the new processes and adapt it. But this COVID time, it has forced them to change their mindset and the processes, because if you do the automations, you need a process engineering, and that process engineering to cut down your different small processes and bring the productivity, your time, and your quality of data. So in these cases, in the healthcare, what it happens, when the patient is coming and you will stop the patient not to come, and you have to give the remote consultations, in that case the process has been changed. But sometimes doctor needs to see the patients. In that cases, you have to check out that whether the patient is needed to visit physically or not. So you have to put we have to use the tools of chatbots, and we are screening the patient, and we have divided the patient that you come through the teleconsultations or you come through the physical physical consultations. This is the one thing I can say you. Another one is the blood testing, because when you do any test, there is a 6 levels of samples. It will be handled by the different human being. That human being means in our case it is the technicians, and the infected blood samples. Nobody want to carry, or don't want to put the blood sample to the machines. So here we have done a pre-analytic and post-analytic automation process, that when you collect the samples till end of the sample testing, till end of the testing and the testing the samples, it is not required any manual intervention. So in that cases, the losing of samples, any means on the process, what it happens, the sample may get contaminated due to the weather, due to the environments. That is also, it has not been reduced, and it has given more faster to giving the result to the people. And in healthcare, we talk just in time. Anything, it will reach to the things in time. We can save the life of the people. So when we do the process, automations, the new process has come up. It has reduced the time, and the productivity has gone up. So the acceptance level of the user level, because the cultural changes has come up during this COVID time, and they have accepted the automations. So this is my submission in the healthcare. This is the difference. What other peoples they are doing it.
Yeah.
Because the cultural changes has come up. This is one of the biggest achievement during the COVID time. I 100% I agree. You see, technology not an issue right now. Whatever you will ask, all the technology is available to you. But choosing the technology, right technology for the automations, in the real scenario, in that cases, many people they failed. What the Vishwajit has spoken, it is true. One example I am giving to you. We have developed a clinical system for the gastroenterology department. It has 7 modules. Very immediately, all the data we are going to capture in the OPD. When we have started implementations, each patient was taking 40 minutes to enter the data. And we are hundreds of patients. It is not possible to do the computations or automation of that place. Then we have discontinued. Again, we have inducted speech recognition systems, which is around more than 99% accurate. That is Cognito. When we have implemented, it has reduced to 10 minutes. 10 minutes. You see 40 minutes and 10 minutes. What is the difference? You look into it. And now people, they have started working on it. This is the one kind of thing. So on the other hand, I will tell you, because AIMS is not only the patient care, it has the research, it has the teaching, it has the selecting the students in the national levels. So all this is involved. Well, just one example I am giving to you. We get around 7 lakhs application for the PG admissions in different AIMS in the country. How to scrutinize the 7 lakhs applications with their photographs and identity? So we have introduced the RPA. It has taken hardly 5 to 6 hours to check their photographs, check their signatures, check their credentials, all these things. It has taken a half a day. And in the manual system, it was taking weeks of time. And many people, they require to be involved. This is the one real example of that. Second one is that I have spoken about the lab computerizations. Today's days, most of the hospital, they are looking towards it should be a paperless. It's supposed to have a filmless. And lab means 2 types. It is the radiological, another is your blood or other samples test. And this is totally when we have done the automations. At that time, in one laboratory, the microbiology, we have around 220 clinicians there. They were working for 8 hours. Right now, the sample has gone more than 800 times, and the manpower is required. It will be around 60, and they are working round the clock. The 60 people, they are working round the clock because of the automations. The process, it has been reduced, and the people's mindset has been changed, and they feel good because earlier they are working very hard. Right now, they have to only observe it. Everything is automatic. So this is the hello. So this is the things it is coming up. Just like one thing I'm talking about it. We get around per day in COVID times, because the sample size is very less, because our less patients they are visiting to the AIMS. It will be around 3.5 lakhs sample test. Okay. So what we have done it, the reporting, it is required within 8 hours of giving the samples. We have targeted it, and we have started the automations. So we have used IoT, another type of IoT device, which is connected with the lab equipments. And this lab equipment has the robotic hands, which will collect the samples without physical handling the samples by the technicians. And it has been totally, whole process is simple. Just collect the sample, then put the sample in the pneumatic tubes. These pneumatic tubes deliver the sample in particular labs where the test has to be performed. From there, automatically, the pre-analytic of the automation, which has the robotic hands, collect the samples, put in the conveyor belt. It will go to the individual machines after scanning the barcodes, and it will process automatically. Just like totally automation, what you are looking into in conveyor belt for your luggage in the airport. It is just look like that. So this is the automation. It has been implemented. Here, the reporting was totally AI based. It is not required to doctor to see the reports whether it is correct or not. Only few samples. If the report is contradictory, in that cases, doctors see the physically. Otherwise, rest of the sample, it will pass through the AI based tool, analytical based tools, and they pass the samples, and it will be reported to the doctors for the further action onto the patients. So this is the one thing what I am talking about. Another one is filmless. Doctor is used to without the films, they are handicapped. Right now, The films is without films, it is available in your mobile, it is available in your computers, it is available in your desktop systems. So all these things, it is coming through the digital, medical digital imaging systems, that is PACS, picture equivalent communication system in the digital imaging. When it is being implemented, when the scanning has been done, immediately the alert has to go to the doctor that your patient this and this is the film, it is with you. And he can download from their mobiles, they can see it, and they can give the consultations immediately. This is the things, automations, it is in the healthcare services. It has improved a lot, but definitely that a lot of teaching we have learned during the COVID time. The culture has been changed to accept the technology by the users. This is the one of the experience we have got it during this period of time. I'll give the new inventions what we have done in our project here. First of all, definitely Upkar has spoken to us. Really, I agreed, and this is the things we are looking towards it. The first one is that the IoT devices. Most of the health equipment it is coming with the IoT device. Okay, even you need the ICU people. It cannot be monitored by the many doctors at a time. So all the vital parameters, equipment has supposed to be come through the IoT device. And it will display in here remotely, and doctor can give the consultation immediately, so that the nurses or the support staff, they can give the treatment properly in the ICUs. Second one is the new invention what I'll tell you. During the COVID time, patients were not coming, but we found that because the particular area is there, it is more cancer prone area, and they have a oral cancer much more. So we have developed one software as well as the device. This is my research project, which is funded by the Ministry of IT. What is there? We need the one photographs in different angle of 6 photographs from the mouth where the ulcer has been seen, with 5 megapixel at least of the mobile. And they, after taking this one, if they have a provision to put the fluorescent light on that ulcer and take the photographs and send to us. What we have another model we have created, and we will process that one, and we can predict whether this ulcer or tumor is a cancerous or not. And the accuracy rate is around 86% right now. So another things we want to make it, we are going to add it, that saliva of that tumors will collect also that one, and we'll develop one kit on it, and that will be tested at the home. If it is red, then it is a positive sign for the cancerous tumors. If it will add on, then will be around 96-97% accuracy it will come up. This process, it will take hardly 5 to 10 minutes. But if you do the process in monotonic manners, it takes 7 days to get the whether the tumor is cancer or not. This is the technology already been in the place, and people have started using it. That's all.
Thank you. Biswajit, what you will say on it?
Okay.